Hi, and welcome to Assessment and Evaluation of Infants, Toddlers, and Preschoolers. Part C of IDEA covers infants birth to 3 years of age. In California, we refer to this program as Early Start. In the Assessment and Evaluation in Early Childhood Special Education Programs Handbook, published by the CDE, disabling conditions are listed as follows. An infant or toddler is qualified to receive special education and related services if he or she has one or more of the following conditions: hearing impairment, hearing and visual impairment, language or speech disorder, visual impairment, severe orthopedic impairment, other health impairment, autistic-like behaviors, mental retardation, emotional disturbance, or specific learning disability. In addition, the CDE states that an infant or toddler is considered in need of intensive special education and services if he or she also meets the requirements set forth in 5 CCR 3031 in combination with 5 CCR 3030. There are 3 ways in which a child may meet those requirements. Number 1. The child is functioning at or below 50% in any one skill area for the child's chronological age. The skill areas are gross and fine motor development, receptive and expressive language, social and emotional development, cognitive development, and visual development. Number 2, the child is functioning between 51% and 75% of his or her chronological age in any 2 or more of the skill areas listed above. Number 3, the child has a disabling medical condition such as a visual impairment, deaf blindness, a hearing impairment, a severe orthopedic impairment, or a congenital syndrome that the Individualized Family Service Plan, or IFSP team, determines has a high predictability of requiring intensive special education and services. Criteria regarding the eligibility of children ages 3 through 5 years of age are established in Ed Code Section 56441.11. Under this section, a child is eligible for special education and related services if he or she meets criteria for the following conditions: autism, deaf blindness, deafness, hearing impairment, mental retardation, multiple disabilities, orthopedic impairment, other health impairment, emotional disturbance, specific learning disability, speech or language impairment in one or more areas of voice, fluency, language, or articulation, traumatic brain injury, vision impairment, or established medical disability. Established medical disability is defined under Ed Code Section 56441.11 as a disabling medical condition or congenital syndrome that the IEP team determines has a high probability of requiring special education and related services. A child who has been diagnosed as such but is not currently exhibiting a delay may be found eligible under this category. According to the California Department of Education, evaluation may be defined as the act of determining a child's eligibility for special education. Assessment is a process through which one determines the child's abilities and need for services. Evaluations and assessments of infants, toddlers, and preschoolers are conducted differently from those of older children. During evaluation, a young child may act differently from one situation to another, and even from one time of the day to another. Changes in the environment, the child's physical state, and the interactions that a child has with significant people in his or her life may have a critical impact on how a young child will react to evaluation settings and procedures. Always remember, you must have informed consent from families before beginning any assessments. Assessments should be non-discriminatory and should also be conducted in the child's native language. So are we teacher or detectives? Assessment can require more than just putting scores on a chart. Teachers may need to rely heavily on observation and listening to parents. Knowledge of typical child development is a must. Assessment results provide the foundation for developing a program to help children and their families move forward. It is important to remember and to share with parents that assessment results, especially initial assessment results, are merely indicative of current performance on a specific day, under a specific set of circumstances, and are not necessarily predictive of future performance or abilities. During assessments, we should describe the actions of the children by writing down or perhaps even audio recording what they say. We should make efforts to describe their mood through observed facial expressions or gestures. When we put this information into a report, it is important that we leave nothing to the imagination. We should not paint a picture that is open to interpretation. Keep in mind that these reports become part of their permanent school file and will follow a child wherever he or she may go. Someone else may use this report to determine appropriate services for this child, so it is important to be thorough. Taking notes on everything can be difficult. Consider conducting an assessment with more than one team member present. Oftentimes, each person is able to pick up on something different, and it can be helpful to assign roles if they are not already clear. Consider structuring the assessment time to allow the child to take breaks. This is not only helpful for the child, but for staff as well. It allows time to jot down some notes and also allows for the observation of how the child transitions from activity to activity. It is also helpful to solicit parent input during this time. Consider creating a form for parents to fill out while you're working with the child. The benefits are twofold. First, you gather information directly from the parent about their child's present levels of performance and information about their strengths and interests. And second, it keeps the parents occupied. Assessment can be a stressful time for parents. Most often they want help for their child, but sometimes they also try to interrupt and tell the evaluators what their child can do, rather than allowing the child to demonstrate those skills independently. Parent notes can be reviewed at the conclusion of the assessment and provide a framework for that discussion. Thanks for watching.